Welcome to New Dentists on the Block, a podcast featuring new dentists sharing their experiences in the world of dentistry, successes, challenges, and life in between, navigating dentistry together one experience at a time. We are back with another guest, Dr. Rupert Monkhouse. Rupert is a general dentist based in London and has a particular interest in removable prosthodontics and shares his cases on Instagram at Dentist Rupert. He also hosts the Impression Club live podcast on Instagram. In this episode, we compare dental education in the UK and United States and how he has honed his skills in removable prost. Rupert has a ton of knowledge and has a passion in sharing that knowledge. Let's tune in. Rupert Monkhouse, welcome to New Dentists on the Block. How are you doing today?
Good, thank you. Thank you for inviting me on. Excited to have a bit of a chat today.
Yes, me too. I'm so excited to have you on as a guest and to meet you in person. I'm obviously a fan. I follow you on Instagram and all the cool things you're doing, which is how, we all meet, I guess, now in this day and age. But Rupert, I would love if you would tell me and our listeners a little bit more about yourself and what you do in the realm of dentistry.
Sure thing. So, my name's Rupert Monkhouse, as you said, or if you're following online, social media and things, Dentist Rupert. I'm a general dentist living in London, and I work in a place called Reading, which is about half hour, 45 minutes away from London, in a private practice, which is mostly a sort of specialist referral practice. But we have sort of 4 or 5 of us generalists as well, and we all have our little niches, and the bit that I enjoy the most is removable prosthodontics, as you'll see and know if you follow me online. And I do a lot of general dentistry, but I'm lucky in the place that we're at that I don't have to do endo anymore. I don't have to do perio, so I can just sort of niche in on the bits that I like doing, which is mostly the removable stuff and a bit more of sort of wider pros as well.
Rupert, I would love if you would tell us a little bit about what the education looks like in London to get into dental school and what dental school looks like moving forward.
Sure. Obviously, I think the biggest difference for us compared to you guys is we can go straight in as an undergraduate at 18, where you guys have got to do 3 years before of sort of pre-med. Yeah.
Sort of. Yeah.
Yeah. So, our younger dentists are younger than your younger dentists because we start a little bit earlier. Now we have to do we can do 5 years straight from the age of 18 after leaving school or college or whatever you guys call it. So we can go straight in at that point. So we generally can come out at 23. So we're actually a fair bit younger, I think, than you guys would be. What, 27 or something? Probably the earliest.
26, 27, give or take. Yep.
Yeah, so people still do another degree before and do a shorter course, but I think that's going to be the main difference. Maybe you guys have got a bit more perspective and things when you start out. You're a bit further down the line than we are, but we do 5 years at university, and then we have something in the NHS, the National Health Service, a foundation year, a training year, essentially, where you get sort of allocated somewhere around the country to do your year of sort of mentored training. Sort of it's structured. You have people in your area. I got shipped up to the northeast to a lovely place called Hull, which has a not so nice reputation, but I'm absolutely fantastic time up there. Wouldn't change it for the world. But for me, it was great. We had a laboratory on site, so I was hanging out with a clinical technician all the time, and we had a sedation contract as well. So people in the area, all of the northeast of Yorkshire, who needed sedation because they were anxious, they got referred there. And then if they didn't have immediate dentures, I'd make some. So I think in a year I made about 60 pairs or something. So I got a lot of experience there. So that helped me to really push on my passion for removable, which came from third year of undergrad when we started it. I just had a really good teacher, and one of those teachers that's just really enthusiastic, and you just get sort of dragged along with it, and you can't help but enjoy the subject. So went from there, and then the practice that I'm in now, I work with a phenomenal prosthodontist, implant prosthodontist, and it just sort of fell into the right places to keep working with that passion.
With the NHS, is this kind of like service in an underserved area? Is it more of a residency kind of thing, or what would you say that is like, really?
So you have to do that initial year if you want to work in the NHS in any capacity. So if you want to just have you have a contract here. It's probably all a bit crazy for you guys. You have a contract here to do a certain amount of units of treatment. A checkup is a unit. If you do a filling, it's 3 units. If you do 20 fillings and a root canal and perio, it's still 3 units. So you just pay for the most expensive thing, and you get paid for the most expensive thing. So if you want to work in that clearly very appetizing system that I've just sold to you there, you have to go and do this training year. But it's a nice structured year. You've got, by sort of the whole program, you've got a mentor in the practice all the time to help you and do tutorials, and you meet up with, I don't know, 20 of the local other ones in the 50-mile radius every week and do a study day kind of thing. So
cool.
It's a really nice way to do that very first year as a proper new dentist, to sort of get your feet under the table a little bit.
And then all graduates go through that.
Pretty much, unless you go straight into private practice, which, unless mummy and daddy own it, probably isn't gonna happen realistically. I mean, I started in my all private practice that I'm in now about 2 months after finishing that 1 year period, but that was literally like alternate Saturdays kind of thing, and my 5.5 other days a week I was working in a fully NHS practice in London. So it takes that time to develop your skills, develop soft skills and clinical skills to get into that environment. So it's quite a different system to you guys, which is essentially all sort of private or sort of hospitally based, I guess.
Yeah, you have a kind of your say of where you want to go and what you want to go into. But it sounds like they place you in a program. You don't have a whole lot of say of the area you'll be in.
Oh, you do. You do when you're in your final year. I think it's about the November time of the final year, with the term finishing in sort of May, June. You do a sort of interview with situational judgment tests, ranking the most appropriate, most inappropriate, and all that kind of stuff.
Okay.
And then you get a national rank, and then you rank all of the areas, the 50 areas of the country. And if you're number 1, you get your first choice. And if you're number 2, you get your first choice unless someone else has taken it, and so forth. And
okay.
I didn't do very well. I ranked about 750th out of 900. So that's why I got shipped up to the northeast where no one else wanted to go, apparently. But, it sort of pushed me out of my comfort zone a bit. And I fell into a perfect scenario for me. And I made some great friends I still talk to, and I wouldn't change it at all.
What a cool experience. I think that, like you said, it pushed you out of your comfort zone. And I mean, anyone can do anything for a year. So that's pretty cool. I think that's a unique setup that you all have.
Pop away for a bit. But, we're a lot smaller country than you guys. If you guys got shipped halfway across your country, it'd be a bit of more upheaval.
Big deal.
Yeah. It was 2 hours on a train still from London, so it wasn't that bad.
Oh, yeah, that's not bad at all. Oh, that's not bad. I want to backtrack to what you were saying about having a mentor in dental school who was passionate and good at removable, and how they instilled that to you to kind of pick up those skills. What was that like for you in dental school to kind of learn about removable and continue to learn that after you graduated dental school?
I mean, to be fair, I just love dentistry overall. I know I said earlier I haven't done a root canal and I'm happy about it, but in third year I had that great tutor in removable and loved it, and he, I think, taught me very well, whether it was because we have similar communication styles or whatever, so it sort of goes in better or what. But then in fourth year, I didn't like my removable teacher as much, and it sort of went down the pecking order. But then I had a great perio tutor, and then I loved perio, and I thought I was going to do perio kind of thing. So I'm very much one of those. I like deep dive into like one thing and sort of go down the rabbit hole. But and then fifth year it was sort of more wider restorative, and endo came into it and that kind of thing. So, and in my early years in practice, I really enjoyed endo as well. But it always came back round to the pros, and particularly the removal, which is obviously seen as more of a niche thing. It's the dark art or whatever it is that
the dark art.
That's funny. But I think I think just with this tutor, he was just really. I think he just taught it in a really good way, the basics. And I say it with when I teach my courses or in the posts that I do or videos that I do or whatever is, I think actually it's not that difficult. I think maybe we over stress it to ourselves, but I think if you can really knuckle into the real core little basics of it, at least for me, I feel I can then work out the more complicated cases. Just always sort of strip away all the extra stuff that you're stressing about, which is probably true with a lot of dentistry. Just narrow in on nailing the basics, and then actually you can work out the rest of it. And I think that's what he really taught me, to sort of see the bigger picture of it.
Very cool. I'm a removable fan, so I work in public health, and obviously I do a lot of removable, lots of extractions, lots of removable, and I agree. I think that there are a lot of basics that kind of carry through a lot of different cases, and it's those complicated cases that take a little bit more work, but the basics, the foundation, kind of can carry you through.
Mm-hmm.
Um, those complicated cases, at least at first. But what I really love that you share, and something that I continue to learn, is you have a lot of like pearls and tidbits that you've picked up probably from your practice that really, I mean, can really, really make a difference. And I think, not having somebody here, I think if you don't have that mentor, it's hard to pick up those pearls. So I would love to know how you've picked up a lot of those removable pearls along the way, and what has helped you.
Sure. I mean, a big one is social media, and that's obviously how we've connected here. 'Cause I think we're so fortunate as young dentists, as new dentists. I'm still count as your new dentist category. I'm 6 years
Yes, that's right.
graduated, so that's good.
Very
That's
good.
good. I forgot to say that I graduated in 2017.
Oh, okay.
So I think for us at the start of our career, when we're very social media savvy as well, and things like that, it's just commonplace that you're going to learn stuff from it. And I think so much of it is from that, and you just see something and give it a try, and see something else and try and reverse engineer it, an impression technique or whatever. So a lot of it's come from social media, and I think if we utilize that correctly as a new dentist, I think it's a really powerful tool. I talk about it a fair bit on my channel with various guests as well, that it's a double-edged sword, and we've got to be a bit careful with it. And then just lots of YouTube, lots of random articles and things like that. I'm not the best quoter. I'm the worst quoter of papers and things like that.
Oh, me too. Yeah.
Don't ever ask me
It's
for a
in there
reference.
somewhere.
But I sort of read it somewhere and I gave it a go,
Yeah.
and it worked. And I've been doing it for 2 years now, and it still works. But I couldn't tell you where I first read it 2 years ago, kind of thing. So I just take a little bit from everywhere, and I've been fortunate with the contacts I've made with my podcast and things like that. That particularly in the UK, at least, I've got really good connections now with some of the best removable guys out there, and a few guys over in the States as well, and a few in Australia and things. So, and then it's just messaging people. It's sending a picture and saying, what do you think of this, and discussing it. And even so, we're running a primary impression course here in the UK, and we've got a group with all the delegates that have been on, and it's 60 odd people in that group now, and every day someone's sending a message in, and we're all sort of going in and saying, we'll try this next time, we'll try that. And I think just having that wider network really, really helps with it. Even if you're not literally going in every day trying to get something out of it, you don't necessarily realize how much you're taking in from just seeing these bits around wherever it is.
Did you ever have an interest of maybe going back to school and studying to specialize in pros?
I am in September, yeah.
You are? Oh, that's wonderful. Look at that. That's cool. So what got you there, obviously, other than, being passionate about removable?
So I applied last year as well. I wanted to do it for a little while. I think I just love the subject and want to learn it a bit more. And I think because of how I have learned the subject so far, of, like we said, just sort of picking up little bits here and there, you learn a lot, but then you've not necessarily got the breadth of the knowledge. And I think it's true as well with our sort of postgraduate education that we do. You go and do that composite course, and then maybe you do that occlusion bit and that veneer bit, and then an endo course or whatever it is, and you sort of look at a little bit here, a little bit here, a little bit here, but then you don't get that full sort of comprehensive bit because you're just sort of picking and choosing. So I think the idea of getting that sort of forced teaching of everything was the main driver. But also in the practice that I'm at, I say my boss and mentor there is an implant prosthodontist, and he wants to be doing more and more surgery and less restoring. So it's the next step doing from removable is doing full arch implant prosthesis. So
sure.
The plan, I wanted to get get that basis. He's done the Dent as we have it here. I'm not sure what you guys have in terms of the specialist. But yeah, the Dent, he did it 20 years ago. And it just seemed like the next progression to be able to then step up to that level.
Well, to answer your question, we don't technically have a specialty in implant dentistry. We have, prost and perio is pretty much all we really have.
Yeah, we don't here either.
Oh, okay. What does prost residency look like for you all?
So it's the bit I'm doing is a 4-year course, 3 days a week in the hospital and the university. You can do it 3 days a week. For 3 years, 5 days a week, so full time. But that's generally just for international students to get it done quicker. So so from September I'll be doing 2 days in the practice, 3 days in the hospital, and that's
pretty cool. It allows you that flexibility to still work and to learn at the same time.
Is it only full-time option in the States?
Pretty much. Yes, pretty much. It's a full-time option. I think it's 3 years full-time. So it's
and that was it for me. It wasn't feasible to be able to do a full-time one.
it's hard.
Yeah, absolutely. So I'm looking forward to that in September time.
Ooh, I look forward to seeing the content that you produce based on kind of your experiences and stuff. Take us along on the journey.
Yeah. Behind the scenes in the lab for hours and hours on end.
Yes, of course. Speaking of producing content, I would love if you talk a little bit about your podcast and Impression Club and the lives that you do on Instagram, which are really great with the different guests that you have.
Yeah, sure. I mean, the whole thing's a complete accident, but that worked out well and just kept it going. I mean, the Impression Club started as a bit of a joke hashtag between like 2 or 3 of people that I studied with, and someone just put hashtag Impression Club. We'd sort of tag each other in stories, and someone put Impression Club, and I was like, I'm stealing that. That's really good. So shout out to Sana. Thanks, Sana Sadiq. So I nicked that off her and just sort of went with it. And sort of Instagram for me only really started in sort of 2020, just sort of after COVID lockdown kind of thing. Before that, I was just doing it just to look at people's work. I made a separate account because I realized when I was in my NHS practice, seeing 40 patients a day, not feeling like I was doing anything, I was like, I don't want to see these really good Instagram dentists doing beautiful dentistry that I can't do because I'm only 2 years graduated, but also because I'm not in the place that facilitates me doing that. So I made my dentist Rupert account to be able to just switch it off. If I want to go look at some teeth, I will. If I don't, I like photography and stuff. I'll go and look at all my landscape photographer friends from around the world or whatever. So that's why I started the social media. And then I didn't post anything for about 2 years on it, I don't think, and just slowly started showing stuff. And then Impression Club happened. And then it all went a bit nuts with like one video that was a suction fit lower denture. And I think it got like 75,000 different people saw it or something crazy.
Wow.
For me at the time when I had like 800 followers, it was pretty nuts. And then within 2 months of that, it was like 5,000, 6,000. It was just going sort of up and up. And then the reason the podcast started was, again, by accident, because I was then getting lots and lots of messages all the time about pros, which is great. I love interacting with people like that. It's cool. You meet some cool people. But it very quickly dawned on me that I was getting asked the same like 4 questions over and over and over again. And I was like, as much as I'm enjoying this, it's getting a little bit tedious now. So I spoke to my technician at the time, Ricardo, who was in the very first episode. And I said, let's just pick like 5 of our patients and let's just do a video at a time where we will just discuss like the whole case, start to finish. And we'll pick them so that it's got a complete denture, a partial denture, a chrome denture, a bilateral free and saddle, and a fibrous ridge, or an immediate denture, or something like that. I was like, and then I can just be like, "Hi, yeah, thanks. Go and watch video number 3."
That's right. Yeah, refer to
12 minutes and 48 seconds into this video. So that was the plan, and we did then the very first one on sort of communication, actually, like dentist technician communication. And then a bunch of people, and it was awful. Please, anyone listening to this, do not go back and watch it because it's just horrendous. I think I'm on like episode like 107 or something now, and it's a lot more polished than the first few. It was dreadful, so don't go and watch that episode. It was good though. But a few people wrote back and like, "Oh, that was really good. You should do it with something else." And there was a British dentist that you guys should all check out called Alan Bergen, the Cornish dentist from Cornwall. And he was like, "Oh, that was really good. You should do it on something else." And I was like, "Haha, okay. Do you want to do one then?" Because he was like a much bigger account than me at this time. And he was like, "Yeah, right. That'd be really fun." I was like, "Oh, okay." And then that was it. And then I had it. We did it on Gothic arch tracing, and it just sort of went from there. And then it went from me trying to get out of sending DMs to 100 plus episodes, people from all over the UK, and I've had from America and Holland and Australia and New Zealand and all sorts of stuff, India. So it just sort of came out of nowhere, really. But I love doing it, and it's same as yourself. It's great to just have these conversations, meet these people,
Yeah, super fun.
and you get so much more out of it than you realize, I think, as well. But just
for
a
sure,
happy mistake, really. Happy accident.
I gotta say, they have become more polished. I don't think I saw the first one, but I saw some of the earlier ones because they're around this time, which is great because it's lunchtime for me here, and so I've tuned in on a few, and I saw a few recently that were on your page, and they're really nice. I mean, they're very different than where you first started. I feel like it's more polished, like you said, more refined, which is really, really cool.
Well,
not that the first ones weren't, so.
Oh no, they were dreadful.
They were good. They were good. It's just a different style now,
Yeah, I had a guy on the other week who had been on, I don't know, episode like 20 or something, and he said it within like 5 minutes. Like, just on the thing, he was like, "Mate, this is just so much slicker than it was before." And I was like, "I've done like 100 since we were last on that." And like, it does.
You've put your 10,000 hours in.
I've done I nearly have, to be fair. I reckon it won't be far off.
Surely. You mentioned something, and I think I saw the video, and I've seen other videos as well, but that suction on that lower denture, tell us about that technique.
It's a bit of luck, to be fair. Don't let anyone tell you otherwise. But I think key thing, like with lower suction, is a bit of luck, but then just trying to get that functional impression right. So I think the main thing I say, we run a primary impression course, just a whole day on primary impressions. And when we first put it together, we're like, this is absolutely nuts. There's no way we can do a 1-day course on primary impressions. And yet every time we do it, it gets to 5:30 and people have still got loads to do and they want to keep going. And we're like, no, you've got to go home because I want to go home. And it's amazing how actually like nuanced even just that bit is. But we go on at that appointment or that course about really overextending that impression and making it far bigger than your denture will actually be, to find all of the right landmarks. So I say on the course, I say, well, it's the primary impression is like your picture frame. All you care about is that outside border. Don't worry about any of the detail in the middle. You're going to paint your picture with your secondary impression. That's the detail. That's the important bit. But I think the issue then comes is that people talk about rolled borders and all of this and the big fat borders, and then they think that's what they need in their secondary impression, which isn't the case. If you're replicating your primary impression, big rolled borders in your secondary, it's going to be overextended. It's going to be outside that functional sulcal space, and you're not going to get any suction. Or if you do, it'll last for about 2 seconds until the patient says, ooh, and then they'll push it out. So it's appreciating what you're looking for in the primary impression versus the secondary. But if you get that good first impression so that you can see all the landmarks, or your technician can, the good ones that you want to get for the lowers, we want to get into that lingual space. We want to make sure we get right back to the retromolar pads that you can compress onto, and get a nice broad base as well over the buccal shelves, like the stabilizers on a bike. If you can capture all those things and then find the bad stuff as well, where the tongue is, where the frenal attachments are, then your technician can make sure your tray is away from that. And then getting a nice thin bordered secondary impression that's then accurate, is not overextended, because then it's going to exist within the functional space that there is. And there's a post on my page really, really, really far down of like an inverted lower ridge. Like there's literally no height at all. But that had suction because it was operating within this functional prosthetic envelope. So if you sort of play by those rules and then have a little bit of luck on the side and a good technician that finishes it all up properly, then you're absolutely fine. I've lost you like an old
I'm
school
so very sorry.
VCR. That was
Yeah,
exciting.
yes. Throwing it back.
But yeah, so it's just existing in that correct space.
I love dentistry because it's such an art, but the way that you just explained dentures, you made them sound phenomenal. But it is really, I mean, it's more than
It's the
just,
accent, though, isn't it?
it's the accent. Yes, absolutely. But it's more than just, slabbing material and taking an impression. It's kind of looking for those landmarks and treating the tissue appropriately to capture what you need to allow your technician to kind of help you build a product that is successful for your patient.
Yeah, absolutely. And it's when, I made the joke on the course of like, I remember back in third year and that great tutor Andreas was coming over and, he's going to check your impression. I'm staring, I'm like, I haven't got a clue what I'm looking at here.
Yeah.
I don't know if it's any good. And actually that's some of the biggest feedback from our course is people go, actually, I know what I'm actually looking at and looking for now. And even if I was capturing it before, I didn't even know that I was capturing it before. And if I wasn't aware that I wasn't capturing it. So it's knowing what to look for and nailing that anatomy. And I've got posts about that. And then when you get to the secondary, is make sure you capture it. But then I think the biggest thing is looking at the outside of the impression tray, because we obsess with the fitting surface, right? But actually those flanges and the outer surface of the tray wrapping around is actually technically an impression of what your flange should be like, and that's why it's got to be nice and thin and skinny. If essentially you hold your impression upwards like my pictures and then tilt it away from you, you should be able to look at that and it should look like the top of the denture. If it doesn't, then it's too big, it's too thick, and then your technician's guessing where that cheek is going to be. So I think that's the really underrated bit is we always focus on that fitting surface, but we forget the flange. And we always get told about the way we get retention of tuberosities and whatever, but we always forget about the muscle action on the flanges. And actually, I think that's the biggest thing. Really, is if it fits decent, it's going to hold in there. But the real successful denture wearers are those that are able to control it with their cheeks and their tongue and things like that. And
right.
That's how you actually get the success. So don't ever forget about that part. And of course, that's where saying that experienced denture wearers, that's a bit we overlook as well, actually, is that sometimes I've had patients come in and I go, oh, this is going to be a home run because their lower denture's this tiny thing and it's literally floating around. And the patient's like, oh no, I just want you to fix my top one.
They love it. And you're like, how?
But they're an expert. They're an expert denture wearer, and sometimes we forget about that side of it as well.
Yes, yeah, I think that patients getting accustomed to it and really, shaping it to be their own goes a long way as well too. Patient selection, I would say, is also part of it, at least from my experiences. But muscles are very strong. Muscles can dislodge a denture very easily, so you got to incorporate them, bring them into your workflow when you're building a denture because they can make or break you, in my opinion, as well.
Absolutely.
Well, Rupert, when are you going to drop that online course?
We get asked about it all the time. We
get
asked about it all the time. And I don't know, it's difficult because the impression course that we do, it's a whole day, but we probably spend no more than an hour of that day actually with a keynote on the screen. It's talk for a bit, straight into the clinic, and we're doing impressions on each other, have a coffee, come back, talk for a little bit more, go and do another type of impression on each other. And then in the afternoon, here's 10 scenarios of edentulous and partials on models. This is how we would do it. This is how I'd do it if you're doing it with compound. Off you go for 2 hours kind of thing. There's very little sort of content. So I think how can we give if we can give the same value that we give with the in-person course online, then great. I don't think you can. But if we can get something that's not awful, then you'll be the first to know. Don't worry.
Oh, I will for sure be there. I will be part of that course for sure. Well, before we wrap up, I would love to know what you do for fun in London and what life is like out there.
It's a bit expensive at the moment. The UK is all over the place,
Ah,
but I like doing a bit of photography. That's my sort of hobby. I've been a bit lazy with it lately because I've been doing too much photography of plastic teeth instead. But yeah, I like to do a bit of photography and just sort of. I mean, London's just a great city just to be sort of hanging out in and. Weirdly hanging out with just a lot of dentists. That's the thing with social media dentists. You just find loads of you around and you're just hanging out
yeah,
with them all the time, which
not a
is
bad
great
thing.
fun. It's not a bad
Oh,
thing at
so
all.
fun,
Again,
so
again,
fun.
you're,
Yeah.
you're learning so much there. But yeah, when I'm not taking pictures of teeth, I like to be taking pictures of some landmarks or some
Cool.
landscapes, or trying to get a bit of travel in. I'm off to South Korea in September, just before I start the course for a
Nice.
little break. I'll try and tie it in with an America trip just to run a course. Maybe that could be
Yes, please do.
maybe that'll be it.
Yes.
I've been speaking to a couple of people about it, so
Ooh,
maybe
okay.
it's a thing. Maybe it's a thing.
Okay.
Who knows?
All right. We'll have to tune in, and hopefully it won't be too far, and I can pay a visit or something. That would be really cool.
That'd be great.
Rupert, well, I appreciate you so much for taking time out of your day to speak with me and our listeners. And if our listeners would like to connect with you, what's the best way?
Best way, social media, Instagram. I had Threads for about 3 minutes and got bored of it. So just go for Instagram. At Dentist Rupert is the best way. If you want to check out the podcasts, they're available on, I think, every major podcast platform. The Impression Club Live podcast. And my website, impressionclub.co.uk as well. It's got information about courses and things. And if we do an online course, that's where you would find it. But it's also got links to some of the older episodes as well. But yeah, drop me a DM, slide into those DMs. I'd love to chat to some of your listeners.
Instagram University is so real, and your page is, in my opinion, one that I gain true value from. So I highly encourage our listeners to go check it out, especially if you're interested in removable dentures and getting better in that skill. It's a lot of fun, I would say.
If you're not interested in removable dentures, well done for hanging around for 30 minutes, and don't go on my page because it's only dentures apart from the podcast episodes. So
that's right.
If you don't like dentures, stick to the middle column with everyone else's faces on that isn't mine, and they're probably not talking about dentures there.
Oh, very good. That's great. I love that. Rupert, well, thank you so much for your time today.
Pleasure. Enjoy the rest of your day. Hope you enjoy the rest of your lunch.
Thank you. Thanks for tuning into this episode of New Dentists on the Block. If you'd like to connect with Dr. Rupert Monkhouse, you can find him on Instagram at Dentist Rupert. Be sure to tune into his podcast, Impression Club Live, and check out his newsletter on his website, impressionclub.co.uk. If you would like to connect with New Dentists on the Block, you can find us on Instagram at New Dentists on the Block. If you have a new dentist that you would like to recommend for the podcast, be sure to send an Instagram message to @NewDentists_on_the_block. And don't forget, you can connect with me on Instagram at tsmaestas.dds. We'll catch you next time.